Wisconsin's Governor Walker plans to introduce what he calls a healthcare stability plan. I'm Bryn McBride of ABC for Health. This was at an announcement made this past weekend where Governor Walker said he wants to help shore up the Affordable Care Act in Wisconsin and make some other permanent changes, all to help bring down the cost of health insurance while stabilizing the Affordable Care Act. Now, these comments were made in front of a forum on the cusp of the State of the State address, where we hopefully will learn a little bit more. But some of the details that have been released look as follows. The first change would be to request a state innovation waiver, a Section 1332 waiver from the federal government to help create what looks like a reinsurance program that a few other states have created, putting a little money aside to help pay the premiums of very expensive patients. Now, this would be following the model of states like Minnesota, for example, that have already created and gotten federal approval for a reinsurance program. Now, this waiver, this 1332 waiver, is made possible by the Affordable Care Act. It's different than the Medicaid waivers we've been talking about thus far, the Section 1115 demonstration waivers. The Section 1332 waivers are innovation waivers to help the insurance market along in your state, which is exactly what the governor wants to do. Now, at the same time, Governor Walker said he wants to make some changes to some state laws to make permanent the prohibition against discrimination against those with pre-existing conditions, and to make permanent the senior care program for prescription drug assistance for seniors. All of that would have to be done by state law, and some of that might need a little extra federal approval, such as that senior care move. Now, all of this would be done, of course, while not accepting federal Medicaid expansion money. The money that would go into reinsurance would be a combination of state and federal money, but it would be largely that money that's accumulated from savings, from cost savings, not expenditures, but there would be no Medicaid expansion money in this mix. So let's look a little bit closer at that reinsurance program. The reinsurance program that Minnesota has, it's one that helps pay the very expensive claims, those that are between $50,000 and $250,000. That's what Wisconsin would like to do. Wisconsin said, Governor Walker said he's thinking it would be about a $500 million investment in reinsurance that would help make this possible. Unfortunately, that's half of what Minnesota had invested. So right away, some critics and advocates are a little skeptical about the success of this kind of program. It also, the way it's written right now, relies on CHIP funding, which up until this point, and maybe there's some agreement coming in the short term, has not been refunded. Now, there is legislation that the governor wants to implement that would prevent insurers from blocking patients with pre-existing conditions. This was originally written by Democratic Senator John Erpenbach and Democratic Representative Daniel Riemer. The Erpenbach-Riemer bill was introduced and passed in the Assembly a while ago to make sure that we could protect those folks with pre-existing conditions no matter what was happening in Washington. Well, as you can imagine, this was rewritten by the Republicans and is now being introduced as a way to help shore up those consumer protections to make sure that folks with pre-existing conditions aren't being discriminated against. Unfortunately, the rewrite added a little provision to it that said, but only if those patients have a history of maintaining coverage. So that's the big asterisk at the end of that writing. So that there, as you can imagine, some Democrats are a little skeptical of that rewriting. The first round, Senator Erpenbach said he's going to vote against that. If it comes up again, he might just vote for it to make sure that the protections exist. But you can understand how folks with pre-existing conditions might be a little bit nervous. OCI would be the Office of the Commissioner of Insurance would be in charge of figuring out what to do with people that fall into the gaps, those people that have not had continuous coverage and still do have a pre-existing condition to make sure that they're protected. Now, all of this, of course, is speculative based on what happens in the future. So far, there has not been success to repeal and replace the Affordable Care Act and therefore the protections for those that have pre-existing conditions. Right now, the Affordable Care Act still does protect everybody with pre-existing conditions. This would just be extra state protection should anything happen to that federal mandate. Now, there have been some efforts lately in Washington to chip away at protections of the Affordable Care Act. So it probably is wise to make sure we do have some of those state protections in the background. Why is all of this happening now? Shoring up senior care, shoring up making sure folks with pre-existing conditions aren't discriminated against, and making sure that we have a little reinsurance program. This is a little bizarre coming out of this governor, the one that was very vocal against the Affordable Care Act, said the Affordable Care Act wasn't working, and Wisconsin joined the lawsuits to repeal the Affordable Care Act, to stand in the way of any progress being made in the past. And he was actually pretty vocal against protections for senior care in the past and for stability in the marketplace, saying we should just get rid of the Affordable Care Act instead of building programs like reinsurance. So this is maybe his Dr. Strangelove moment. So this is Governor Walker, how he learned to stop worrying and embrace the ACA. What other folks are saying is, you know what, these parts of the Affordable Care Act, the making sure people aren't discriminated against, are the most popular parts of the Affordable Care Act. And guess what? It's an election year. So folks are saying this is the re-election healthcare plan. The popular parts that folks across Wisconsin are in favor of are the parts that we're seeing right here appear in the form of this ACA, Section 1332, and state plans to shore up the Affordable Care Act in Wisconsin. It's an about face. And it's, instead of tearing down the Affordable Care Act, which is now politically not popular, it instead is trying to give it a little bit of strength and some legs. It is also that response to that failed attempts to repeal, but also maybe with a little crystal ball that those attempts might not completely go away. So it might be wise to have a couple protections on the books in Wisconsin. And again, capitalizing on the popularity of the Affordable Care Act. The one shortcoming, there are a couple shortcomings. The big one is the fact that the state would be doing this itself without accepting that Medicaid expansion money. You can go ahead and read the governor's press release where he talks about this. The State of the State is coming up this week. You can watch there, see if we have any more details coming out of it. In the meantime, the Milwaukee Journal-Sentinel has gone through with a little bit more detail to help round out our understanding of what's in the stability plan from the governor. You can contact us and share your healthcare story or ask a question. You can do all of it at healthwatchwisconsin.org. Thanks for watching.